Hi, it's Dr Michael Ghobrial here from Shaw Dental. One of the most common complaints that we hear from patients is actually around tooth sensitivity. Teeth are sensitive to hot, cold, or even sometimes sweet. And we often get the question of what's the cause of my sensitivity and how can I manage it? So I thought I'd record this short video to give you 3 of the most common reasons for tooth sensitivity and the solutions that there are for those particular reasons. The first common cause of tooth sensitivity is actually gum recession. Gums can recede with time due to either your individual anatomy that makes them susceptible to it, or often toothbrushing trauma by using a bristle that's too hard or incorrect technique. They can also recede due to inflammation around the gums and a lack of regular hygiene appointments. But whatever the reason is, the gums recede and expose what we call the root surface, which actually has nerve endings at the end of them. And the teeth can get progressively more sensitive. In those scenarios, often our management is actually first dealing with the cause of the gum recession so that we can try to prevent it from getting worse. And then we try to desensitize the actual tooth structure. We use things like concentrated desensitizing agent, which we apply to the tooth, or even using sensitive toothpaste and applying it in a particular manner. And that can be a really effective way of dealing with your tooth sensitivity. But the key with that is to make sure that we've got any of the causative factors under control so that the gums are nice and healthy and you're seeing a hygienist regularly and we're not traumatizing the gums with our toothbrushing technique as well. The second cause of sensitivity can actually be tooth decay, where a hole develops in the tooth. As decay or the bacteria eat into the tooth structure, we can get into the areas that expose the nerve endings, and that is why you would notice some tooth sensitivity. It's best to again assess, manage these things early, but if that is identified, whilst it's small, it's usually going to be a simple restoration or a filling to seal everything up, to clean out the bacteria and to remove the sensitivity. Again, it's a matter of identifying the causative factors to stabilize it and prevent it from happening again so that you don't need a new filling or need fillings elsewhere in your mouth. The third cause of sensitivity is sometimes people have a clenching or grinding habit of their teeth when they're asleep, and that can cause generalized bruising of the ligaments of the teeth and it can make them quite sensitive. The best management in those scenarios can be either to make a guard or a splint to wear at night. Sometimes the damage is actually happening during the day, and so a muscle relaxant in the jaw could be a good solution. Something like Botox, or even sometimes we partner with physiotherapists that specialize in jaw tension. So these are 3 of the most common reasons why people experience tooth sensitivity. I hope you found this helpful. If you're experiencing tooth sensitivity, I'd love to encourage you to get it checked out. Make sure you get to it early. It's easier to manage that way. And also, we don't want you living with that sensitivity and discomfort. So if you're experiencing tooth sensitivity and are in the Brisbane area, we would love to look after you. Simply complete the form on our website at shawdental.com.au. Give us a call on 3256 9111 or direct message us via social media, and one of our friendly team will be in touch to organise a consultation. I'll see you at the next video. Thanks for watching. I hope you enjoyed the video. We are regularly making new videos with tips and tricks for your dental health. So please subscribe so you can see our next video. Until then, I'll see you next time.